matters your health, your mental health and your physical health. And we bring in different professionals that are coming to share with us in their different fields so that we can be wholesome and live quality life. Today, I'm so delighted to have a professional, a medical professional, who is going to introduce himself and take us through a very, very important area of health, and that is the hydrocephalus. Some people call it water on the brain. Others will describe it and say that child has a big head. And today we are going to look into that. The doctor is going to demystify some of the things that some people say, some misconceptions that people have in the community, and a way of helping these families that are going through such kind of health challenges and health conditions. Daktari will take us through from the beginning, where it starts, to how it can be managed. And without further ado, I would like to welcome Dr. Philip to take us through what this is all about. But before he takes us through, kindly, Daktari, you're welcome.
Okay.
I really take this opportunity to welcome you and to thank you for finding time to be with us.
Thank you.
I know you're busy. You have to organize, to plan yourself, and I feel so honored. This show, we really appreciate your coming. Kindly introduce yourself to our viewers, and then we can move from there.
So thank you, Jen.
Yes.
Hello, viewers. My name is Dr. Philip Masai Mwachaka. I am a consultant neurosurgeon and a lecturer at the University of Nairobi. And I also consult at Specialist Doctors Plaza in Kiambu. I'm very glad, and it's my honor and pleasure to be in your show. So thank you so much.
Thank you.
Jen.
Asante sana. And karibu tena.
Asante sana.
Yeah, I'm so happy. You can see the smile on my face because this is a very important topic and an area that most of our communities, some communities, we have challenges, and sometimes people do not have that information and what they need to do. So to start us off, Daktari, kindly describe or define for us what is this water on the brain, so to speak, or the big head. I'm not a medical professional, so that's why I'm avoiding the big name, but probably our viewer is able to now get to see the big head and water on the brain.
So thank you so much, Jen.
Yes.
So the term is hydrocephalus. It is coined from two Greek words.
Okay.
Hydros, which means water.
Yes.
And cephalus, which means the head.
Yes.
So as you correctly said, in lay terms, it just means water, increased or abnormal amount of water within the brain. So first of all, for us to understand this problem, we have to know what is this water.
Okay.
So usually the brain gets blood. So blood goes to the brain, and then it's sieved or it's filtered for us to get this fluid we call cerebrospinal fluid, or the water of the brain. So this fluid is usually clear, just like water. That's why it's called water, and it comes from blood. So it's like a sieve. There's a barrier that sieves this fluid, and the fluid is extremely important because it helps now reach the brain. It helps remove wastes from the brain, and it also helps the brain to become buoyant or to float within the head, because the brain is usually, like, for an adult, is around 1.5 to 2 kgs. So you can imagine if it was just like that, it would be very heavy on the head.
Yes.
So we have this fluid around, just like you see when a boat is in the sea, in water, it just floats. So we need this fluid, otherwise it will be very heavy on the head. So this fluid is usually produced in some spaces within the brain. We call them ventricles. So it's produced, then it flows deep within the brain and comes out onto the surface of the brain. So when that happens, it carries out these other the functions that I've talked about, and eventually it's absorbed on top of the brain back into the blood system. So hydrocephalus basically means abnormal accumulation of that fluid. Yeah, so it's either being overproduced at the source where at the spaces I call ventricles, or there's a problem with the circulation, or there's a problem with its absorption back into the blood system. So it basically accumulates and causes pressure on the brain.
Okay.
Yes.
Okay, so that is now more of like the descriptive part in terms of what it is.
Yes.
Okay.
Yeah.
So everybody, what I'm picking from you is that everybody has the fluid.
Yes. Everybody has the water.
The
fluid.
Has the water.
Yes.
But the amount is what now is different.
Yes.
In our situation right now. Yeah, so yes. And then when that water is there, what causes this much water? Let me just use the layman's language. Much water on this brain.
Yes, so this abnormal accumulation could be as a result of either it's being overproduced. So there's usually a normal rate of how this water is produced. So it can be overly produced. So it's a lot, it's like a tap. When you have a tap and you've opened it fully, then there's a lot of water coming out. So it could be a problem with that, the tap where it's being produced, or a problem to deal with the obstruction of this flow of water. So just like you can have pipes being blocked somewhere. So there's a blockage, then upstream there's the accumulation of that water. So that is what we call obstructive hydrocephalus. So there's something obstructing. And then the final thing is now its absorption back into the blood system.
Okay.
So what can cause these three things, or three causes? First, overproduction. Sometimes we have tumors at the site where we have these ventricles, and we call the site of production is called choroid plexus. So sometimes we have some tumors of these taps, the choroid plexus. So we end up having a lot of this fluid being produced. Or sometimes we have blockage through the flow. So this blockage can be due to many things. First, it can be due to tumors. So you've heard of brain tumors. So you can have a tumor growing along the path where this fluid is flowing, and it can block that path, so leading to accumulation. Sometimes we have bleeding within these ventricles, or bleeding within these spaces where the fluid is being produced. And when you have a clot sitting there on that space, then it blocks the path. Okay. Sometimes we have some infective processes blocking the pathway. Now the third cause is usually problems with absorption back into the blood system. And most of this we see them in patients who have infections. Commonest of these infections will be meningitis. So meningitis affects the sites of absorption. Okay, it causes scars, and this blocks the path of absorption. It also blocks the flow around the brain, because this fluid usually bathes and flows around the brain. So if you have this occurring, in cases like meningitis, there is something called inflammation. So that place becomes the flow is usually restricted. We also see it in some bleeding. When you have bleeding around the brain, in cases we call subarachnoid hemorrhage, but it's basically bleeding around the brain. So that again can lead to obstruction to the absorption of that fluid. Yes.
Wow. There are quite a number.
Yes, there are quite a number. The causes are quite numerous. The other cause, the other way we look at it is either something you're born with,
or something you acquired. So whatever you're born with, we call it congenital. So in some children, we see this common, that in the passage or in the pipes where these fluids is flowing, you have like an obstruction, okay? Or the path is so narrow that the fluid finds challenge passing through. We call that stenosis. Just basically something that is very narrow, or there's complete obstruction of that pipe. So it's basically
completely
clogged.
blocked.
Yeah, so that is called congenital.
Okay.
Then acquired now will be the things I've also discussed. So these are things that develop after you're born.
Yes.
For example, infections, for example, tumors, or even bleeding within the brain. Yeah, so those are two ways of looking at this, the causes.
Okay.
Yeah.
You've mentioned about the children in terms of the congenital, the ones that they are born with.
Yes.
Which one is more prevalent? Is it with the children or with the adults?
So this condition, hydrocephalus, we commonly see it in children, but it can occur across the ages. So anyone can get hydrocephalus, but it's more common in children. And one of the most common causes of hydrocephalus is usually infections, like meningitis.
Okay.
Yeah, like, meningitis is so common.
Yes,
In our setup,
Yes,
because
it
most
is.
of it is infections. Yeah, so we commonly see it in children. Yeah, so the disease burden is more in children.
In children.
Yes.
Okay. So, but just forgive my ignorance.
Yes.
It's not born. The child is not born with it.
No, the child can be born with it, especially in the congenital causes.
Okay.
Yeah, because there was already a problem with the formation of that passage.
Okay.
So if it was completely blocked, then the children are born already with that. And even when the mothers go for those scans, pregnant mothers, they are told that your child is having this condition. So it can be seen even before the children are born.
Okay.
Yeah.
We will come to that,
Yes.
to the tests that are
be
done. But so that means when a mother is pregnant, the formation of the paths, let's call them simply pads, may be blocked because of an infection that the child may get. In the uterus?
Yes.
In the uterus?
Yes.
It is possible?
It's possible. Though yes, it's possible. There are some infections that can be transmitted via the uterus into the child. Okay. Yes. Commonest of that is called toxoplasmosis. Yeah, it's just a parasite. It's a parasite that can be transmitted and can lead to that hydrocephalus. But the commonest ones that we see in pregnant ladies, the hydrocephalus would be, most of it would be the congenital type. Okay. Yeah. By congenital, you mean that there was a problem with the formation of the paths, because the brain starts developing very early in life. Okay, so very early in life, the brain starts developing. So in case of problems or alterations in this formation of the brain, then you can have some of these parts being completely blocked or very narrow, so that we have challenges with this passage of the fluid. Yes.
Okay.
Yeah.
Now, we'll still get into that, more of a class of learning when they're being developed. So even before this child is formed and even is born, how would the even before we go to the test, I think we don't need first to go to the test. I would first ask, how prevalent are the hydrocephalus in our communities? Yes.
So it's highly prevalent. Yeah. So the prevalence are high, and it depends on region to region. So it varies. I can't give you a specific figure. Okay. But we see it very common in our hospitals. Okay. Yeah. So it's not a rare condition. So hydrocephalus is common. Okay. Very common. Yes. So and as I told you, most of the time it's because of infections. And the prevalence of infections like meningitis is quite high in our setup. Yes. And this is because meningitis is most of the time is a result of infection, bacterial infection.
Yes.
Yeah, and so we tend to see so many children with this as a complication of infections like meningitis.
Yes.
Yes.
Okay.
Yeah.
You talked about the condition in children, and you also said it can also get into adults.
Yes.
We'll have somebody who had a normal head, and then all of a sudden it becomes big.
So now maybe I can talk about how the patients will present.
Yes.
So that we understand, because it's a bit different how maybe a child will present from how an adult will present.
Yes.
So I'll start with infants. These are children less than 1 year.
Yes.
Or generally, the children who are less than 2 years, the
Yes.
presentation seems to be almost similar.
Okay.
And then those who are a bit older, presentation is a bit different.
Yes.
So the first person to complain is usually the mother or the father.
Yes.
So usually say the parents are always correct.
Yes.
They're actually the best doctors, because they'll come and report that they've noticed that the head size is abnormally large, bigger than normal. So they'll say that maybe our firstborn child, his head was not as big as this, so we are suspecting something. Or we've compared with other children around, and you're thinking our child's head is a bit bigger than normal. So the other thing that the infants will come presenting with is irritability. So the mother will say that they try to feed the baby, breastfeed the baby, but the baby keeps on crying. You know, most of the babies, when they are breastfed, they come and they sleep. But this child keeps on crying. At night, they are almost the whole night they are awake, crying. Then the other thing is now delayed milestones. So these children usually develop. Yeah, so there's a time the child would start sitting or even standing. So all these things are like programmed.
Yes, yes.
In your body.
Sitting,
the way the Creator made us.
Yes, standing,
yes,
walking.
Yes, even like talking also.
Yes.
So the mother will say that this child of mine is 1 year and has not yet started standing. Or the head is so big, they keep on, they cannot support the head. So anytime they try sitting, the child falls on the side. Oh, this child used to, was okay, was developing well, then suddenly the milestones started to regress, or they just stagnated. Yeah, my child developed well and up to the time he started sitting, but after that he's not been able to even walk. Yeah? And then most of the time they'll tell you around that time the child was diagnosed with some infection. We took him to hospital, was in hospital for a while. Even some will even tell you had meningitis, and then from there, this child has never caught up again. This child is not able to talk. Maybe he's a 2-year-old child. They're not able to talk, and people at that age are able to say some words.
Yes,
but this child is not. Yeah, so delayed milestones. So so those are the main symptoms. The mother will come and complain about an infant. So they have an abnormally large head, and then they have those delayed milestones. They are irritable. Even some will tell you sometimes the eyes usually have they have a down gaze. So it's as if the child cannot look upwards. Yeah, so even the mother will tell you that my child has an abnormal eye movement. So those are some of the things that for infants they'll tell you. And for these infants, the reason why the head can grow and become big is because the bones have not fused.
Oh.
Okay. So when you're born, the bones usually are a bit malleable to allow for the baby to come out of the uterus.
Yes, yes.
But with time they fuse and they become
firmer.
They become firm and become one, like one bone. And that takes time.
Okay.
So for infants, the bones have not yet fused. They have not joined yet. So because of that, then you have that allowance for the head to grow. Now, for older children, when they get hydrocephalus at an older age, then that the process of fusion or joining of the bones has already occurred. So these children usually present acutely, very sick, because they don't have space to accommodate for the pressure.
Yes.
So they'll come very sick, vomiting, severe headaches, and the same also to adults.
Yeah,
they come to hospital much earlier.
Those symptoms, I think it's very important for you to just look into the camera and talk to our parents.
Yes. So parents, this condition presents in different ways depending on the age of the child. For infants, most of the time they come after they've had the symptoms for a while, because the head allows because the bones have not yet joined together, so the head allows for the pressure the head enlarges to accommodate the pressures. So we see these children coming with head enlargement, irritable. They're very irritable, and they also have delayed milestones. That's one of the some of the symptoms. Then also depending on the cause, because if there was some infective process, then we'll be told that they had fever and such things. Maybe they were vomiting and such. For older children, they present much earlier.
Okay.
Yes, because the bones have fused, they've joined, and as I said earlier on, when this fluid builds up, it causes pressure.
Yes.
Pressure on the brain. And when your bones are fused, then the pressure builds up very, very fast.
Okay.
And you cannot actually tolerate it. So these older children and adults will come with severe headaches, vomiting. So anytime they try to eat, they throw up.
Okay.
Yeah.
Okay.
We even call it projectile vomiting, because of the pressures of the inside the skull, or inside the cranium. Yes. These children or even adults may also present with reduced level of consciousness. Yes, so they'll be drowsy, they'll be having, they're almost sleepy, or their level of consciousness has gone down. Yeah, so those are some of the critical things to remember. Then the other symptoms would be based on now the cause.
Yes.
Okay, so if it's brain tumor, depending on where it's growing, you have other different symptoms that it may present with. Yeah. So someone may come with problems while walking. We call it gait imbalance. So they feel like they are falling while walking. Yeah, because maybe that tumor is in a place that controls movement and such. Yes.
Oh, okay.
Yes.
So those ones are now for the children.
Yeah, and older.
And old.
And adults.
Okay,
yes,
and adults.
And adults, yes.
So, and especially now for the adults, it will be like if you are staggering as you walk, if you are having imbalance, then it is easier to notice and also to even to go to hospital.
Yes.
Okay.
Yes.
So now when we have seen all these symptoms, what are some of the tests that the parents will, or the the patients go through so that they can now the diagnosis part of it, so that they can be it can be made, and so that management can also be started.
So when we see these patients in the hospitals, there are some rapid tests or some tests that are quite available that can be used to make diagnosis. So we call them imaging or imaging scans.
Yes.
These are the ones that will tell us whether someone has hydrocephalus or not.
Okay.
And some of these tests or scans can also be able to tell us the cause of this hydrocephalus. Remember I told you you can have overproduction, you can have obstruction through the path,
Yes.
or you can have a problem with absorption.
Yes.
So some of the tests that we do will include first an ultrasound, an ultrasound of the head, or
Yes.
what we call the cranial ultrasound.
Okay.
So this is this ultrasound is readily available in the country, in most places,
Okay.
and is quite affordable.
Okay.
Yeah. So, and this is usually most useful for children under 2 years of age, where the bones, or the what we call the fontanelle, this part of the head, is still open. The one that
this one that
pulsates,
moves
up and down.
Yes.
Yeah. So we can use that
Yeah.
to look at the brain and see whether there's any obstruction,
Okay.
or there's any increased
Now with the ultrasound.
Yes, with the ultrasound.
Yeah.
The other scan we can do is called the CT scan. Again, it's a quick test, around 5 to 10 minutes. And this CT scan, the advantage of it is that it shows us whether you have hydrocephalus or not, and it also shows us the cause. So if there's a tumor, we can be able to see that there's some mass growing here, and this is the one that is causing blockage. Yes, and then the other test that we can do, it's a bit more advanced, is called the MRI, a magnetic resonance imaging. This one now gives us more detail and more characterization of that lesion, if there's a lesion that is causing the hydrocephalus. Yes.
Okay.
Yes.
So those are the three main.
So those are the tests that will tell us whether you have hydrocephalus or not. And then now there are some other adjunct or other additional tests that are usually done in the hospital. And this will include what we call like hemogram, to check whether there's any infection or not. And in some cases, even some fluid can be removed from the spinal, from the spine. Yeah, we call it lumbar puncture, to be analyzed to see whether there was any infective process or there's any infective process ongoing. Yeah.
Okay.
Yes.
So is that the reason why I hear if you have meningitis, you done a test, some fluid is gotten from your spine?
Yes. Yes, yes. So when you have suspected meningitis, then the doctor will come put a needle on the back, on the spine, and get what we call that fluid, the water I was talking about.
The water,
It's
yes.
called cerebrospinal fluid.
Yes.
So it's drained
Yes.
a little.
Yeah.
Then it's taken to the lab for analysis. Yeah, so that can be done to see the cause.
Okay.
Yes.
So those are the main.
Yeah, so those are the main tests. The main test is actually to tell us whether you have this hydrocephalus or not.
Okay.
And that's now the three scans I talked about. The ultrasound, the CT scan head, or the MRI of the brain. Yes.
I'm also imagining that when the parents are bringing this child to hospital, it's because they have had difficulties and challenges in relating in the family. Probably there's something you can say about that. Yeah.
Yeah, so this condition is actually is associated with a lot of burden to the family and a lot of misconceptions. So I don't know if I should talk about the misconceptions.
Probably we'll go to the management.
Yes.
I thought about the challenges that these parents find in terms of the physical part of this, handling the child in the family setup, or even moving the child from. Yeah.
Oh, yes. Now, when it occurs in children, it becomes a challenge to the caregiver. First, because the head is growing, it's becoming bigger and big and very heavy. So you'll find most of this, the child will be dependent on the caregiver. So you'll have to, the parent, the mother, or whoever the caregiver will have to be with the child throughout.
Yeah.
This is a child who can't feed him or herself. It's a child who can't sit or stand. So they're always being carried around. These children tend sometimes even to get some infections because of the positions they are lying.
Yeah.
So they can have even recurrent pneumonias and such. So it becomes a very big challenge taking care of them, especially if that hydrocephalus has not been addressed. And remember, they get delayed milestones because the brain is being compressed.
Yes.
It becomes actually very thin because this fluid pushes on the brain.
Occupies most of the space.
Yes, and pushes it So you have like the brain being placed between a rock and a hard place. Huh?
Like a sandwich.
Yes.
It's
being placed,
yeah.
and the brain developing based on the experiences you're having. So if you're having that pressure, then it means the development of the brain or the growth of that brain is compromised.
Yes.
That's why you see these children getting delayed milestones and such. Huh? Yeah, so it becomes a challenge to the parents. Yeah, because actually, especially of that size of the brain, the child is always irritable, or they're always sleepy, drowsy. Yeah, it becomes a big challenge to the caregiver. Yes.
Daktari, I think now we can move to the how do you manage the condition?
The condition.
Yes.
Yeah.